Hey guys, Bipolar Barbie here, and today I wanted to give it to you straight. I am sick of hearing the same sentence from every mental health organization, from every single person in the goddamn world, which is something that we are just constantly being told that there is help available for mental health, for people with mental illnesses, that we just have to reach out because there's plenty of help available. Well, I can tell you right now that there is not help available. Like, I am living proof of that. And I just think that it's not just my opinion or my personal experiences of struggling to get help for at least 10 years, but it is the same thing that I hear from many people in my situation, from many people that live with and experience a mental illness, and that is that they can't get help. How many times have I been begging for doctors to help me? How many times have I been sitting in doctors' offices when I have been lucky enough to get an appointment and been in a situation where I could financially afford to get an appointment? And I'm sitting there begging them to help me. I'm crying, I'm shaking, and I am just desperately asking for help. I am reaching out, and the amount of times I've told myself just one more time, just reach out just one more time, this time will be it. And I've told myself that at least 1,000 times. But the reality of the situation is that there is not help available. Now, hear me out before you judge me on this, but I think that we really need to understand this. I think we really need to accept that help is not available, because otherwise, how are we going to fix it? I mean, I'm not saying that there aren't places that offer mental health services, because there are. There are facilities out there that are designed to, I guess, provide mental health services, but they're not accessible. They really aren't. I mean, I've always had this opinion because that's been my experience. I've always struggled getting help for a number of different reasons. I don't have the money. I mean, in Australia, it's very much like private health or public health. And I've been told by my own doctors that I'm stuck between a rock and a hard place, that because I'm mentally ill, I can't hold a job, I can't hold stable housing, my finances are a mess, so therefore I can't afford to pay for the ridiculously expensive doctor's appointments. Or I am so sick that I can't get out of bed and I can't go to those appointments. Or I get put on a waiting list. I've been on a waiting list for some mental health services for over 3 years now. Like, seriously. The first time I ever saw a psychiatrist, it took me 4 years to be referred to a psychiatrist. And I was an adult, but I was a young adult that didn't have the support of anyone else, and I was trying to reach out. I didn't have anyone in my corner fighting for me. I had to fight for myself. And doctors and people who have been a part of my journey, in the later part, they asked me, what made you keep going? We honestly can't believe that you are still here today with the amount of resistance that you have had to overcome. And I don't even have an answer to that. I really don't know why. And I came across some alarming statistics to back up what I am saying right now, which I really want to share with you guys, because people need to know this. People need to know that there isn't help out there. And that's the problem. The problem isn't people with a mental illness not wanting to get help or not asking for help. The problem is that when we do ask for help, nobody is there to help us. No one wanted to be helped more than I did. Yet it took me 10 fucking years, and hundreds of different medical professionals and therapists and doctors and psychiatrists and hospital admissions and medication and all sorts of shit to get to where I am today, where I have some form of sanity, where I have some form of quality of life again, where I'm not just like The Walking Dead, where I'm not a zombie, where I can actually function, where I can actually say, okay, you know what? Being alive is bearable, because it wasn't for so long. I didn't live. I was just barely surviving. And out of the 1 in 4 people that they say have mental health concerns every year, I just think it's absolutely crazy that studies show that only 35% of people who have actually been diagnosed with a mental illness seek help, have reported actually accessing mental health services. How crazy is that? That there is 65% of people, 2 out of 3 people basically don't get help for their mental health services. And you can sit there and you can say, oh, that's just because they don't want to get help. Well, I honestly don't know anyone that would want to live like this. What does living like this give you? Nothing. There is a reason that we want to die, because we don't want to live like this anymore. And what is even, I guess, more alarming is when they say things like, out of the entire hospitalization, the reasons people are admitted to hospital, only 1% or less than 1% are for, mental health or drug and alcohol addiction, things like that. And I get that. I mean, that's not because, people don't need to be in hospital for that sort of stuff. It's because you either have to have private health insurance, which is the number one reason why I haven't been admitted into hospital on many occasions when I really needed to be, or the public healthcare system is basically designed for people who are being a public nuisance. And that is the honest truth. I've been to public hospitals. I've tried to access public healthcare, and I've been rejected and I've been rejected. And you know what? It was only recently, after being on the waiting list for the DBT program for like 4 years, that they finally said to me, look, you're not going to get it. You're not sick enough to get it. And I said, what do you mean by not sick enough? They said you had to have had repeated hospital admissions, you had to, be part of the mental health care team, us coming out to your house. And I'm like, I've done all of that. I've been in hospital. And they said, yeah, but you went to a private hospital, not a public hospital. It's bullshit. It is complete and utter bullshit. And you know what is most concerning? Is when they say that help is available and, people might be able to expect to get a decent level of recovery. That is on the condition that they get help early enough. And we know that mental health concerns are way more prominent in youth. I mean, people under 25, 25% of them are likely to have mental health concerns, or it's like 26, 28%. Whereas the older population, it's like 6%. So the youth don't have access, they've got the most mental health problems, and they don't have access because, one, they've got to convince their parents, who are so involved in the stigma and mental illness, they don't believe that they have a mental illness, because in our society, when someone tells you that they're not okay, you immediately deny them, you immediately tell them to get over it. It's fucked up. You know what is even more alarming? 1 in 5 teenagers, 1 in 5 people between the age of 13 to 17 years old have reported having suicidal thoughts. I mean, if you have kids, how alarming is that? How crazy is that to think that out of 5 children, that at least one of them is thinking about killing themselves right now? And even more alarming still, 1 in 10 people under the age of 17 actually try and take their lives each year. Do you know 10 teenagers? Do you know 10 adolescents? And can you honestly believe that at least one of them has actually tried to kill themselves? Just let that sink in. Let that sink in, because that absolutely breaks my heart. And I was one of those kids. I was one of those teenagers, and nobody would have known. Nobody knew. People are still surprised when I talk about my mental health issues, but it just blows my mind when they can say, look, help is available, you've just got to ask for it. Because you know what? I've asked for it. I asked for it, and I fought so goddamn hard for it, and I am proud of myself for getting where I am today. But you have no idea how much it hurt every single time I was rejected, every single time I asked for help. I mean, I have lost count. It would be into the thousands, if not the tens of thousands, the amount of times that I have begged for help from anyone and everyone that I could have thought of. So to say that help is available, that's just, it's unrealistic, because it's not. It is not available. If you're like me and you live in a rural area, then there is not a lot of mental health services available. There is a reason why the area in which I live in has the highest youth suicide rate out of anywhere in my entire country. More people under the age of 23 years old kill themselves here than anywhere else in this entire country, and we are just a relatively small population. There is a reason for that. And I know why, because mental health services just aren't accessible. They're just not. And whether that be money, whether that be just the lack of services in general, whether it be medical professionals that just don't want to help, whether it be the mentality of the community in general. I mean, there's like 14% of people under the age of 17 have some form of mental health concerns. 1 in 5 kids in low-income housing have severe mental health issues, as opposed to 1 in 10 in sort of an above average, or like an average to above average income. So does that mean that the issues that kids in a low income face means that they have more mental health concerns? Or is it simply because they don't have access to the mental health services that people with money have? Because that was my problem. And what's even crazier still is out of all of these kids, the 14, 15% of people under the age of 25 that have mental health issues, only 1 in 4 of them actually get help. Like less than 3% will receive any form of help. And whether that be because their parents, have been able to get healthcare for them. I hear from a lot of kids that I meet on my Instagram and through social media that their parents don't believe that they have mental health issues. I mean, seriously, as a parent, what the fuck is wrong with you? If your daughter has body image issues, if she is starving herself, if she is slitting her wrists, if your children are thinking about killing themselves, and they tell you, and they get the courage to reach out to you, and you simply deny it, you simply tell them to get over it, you simply tell them that there is nothing wrong with them. There is something wrong with you, and you need to be in therapy. Like, seriously, people. And what's even crazier still is out of the most severe cases of mental health in children, the most severe, and by severe, I'm talking schizophrenia, I'm talking like psychotic episodes, I am talking like full-scale breakdowns where they would be a harm to themselves or other people, like serious, serious issues. Only 50% of those kids, of like the 1%, actually get help. And when parents were asked why, every single one of them responded that it was too expensive to get healthcare. It was too expensive to get help for their children. I just think this is crazy. And I just wanted to say this. I just had to get this off my chest. People need to know this. Share this video around because people need to know what it's about. We hear lots of statistics about adults, and that's great. Everyone's mental health issues are the same, but the thing is, with kids and with youth, they don't often have the power. They don't often have the choice. They don't have access to these services unless their parents provide it. And if you were a primary caregiver, a partner, a parent, a friend, whatever, don't tell someone to just get over it. Don't tell someone to just get help, because there just isn't help available. And as a society, this is the problem. This is the issue. So, I wish that there was more help available. But the honest truth is that there's not.